When you step back and think about it, should your baby or your toddler actually smell like watermelon or lavender or like whatever? Like they shouldn't. They're not meant to.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Dr. Sheilagh Maguiness, professor of dermatology, a pediatric dermatologist, and co-founder of the Strike Club. Thank you, Dr. Maguiness. Thank you for joining me. I appreciate you being here.
Well, thanks for having me. I love doing podcasts. This is such a fun educational format.
Yes, it's exciting just to see, well, number one, what you've done in the pediatric space. I'm excited to learn more about that, but I'd love to hear what got you into this space in the first place? Were you always wanting to be in dermatology?
Yes. So you know what, Janelle, I always knew that I wanted to work with kids. And then, going through medical school, I was just really interested in the visual nature in dermatology. Mm-hmm. And then it even got more specific because I had an experience where I had exposure to children with rare vascular anomalies. And that truly sparked my interest in pediatric dermatology and led me to find a mentor and get more training and commit to doing the fellowship. And so I am a board certified pediatric dermatologist. I work for a university in an academic setting, and it's just a really busy, really exciting and just a cool practice. One thing about pediatric dermatology is that we are small. There are only about 400 of us across the nation. So we're small and we're growing, and we're hoping to even attract more students and residents to have an earlier interest in pediatric dermatology. So that's another cool thing I think these podcasts do is for students or trainees who might be listening to just give some thought to a career in pediatric dermatology. We do extra training to really make sure that we know and understand how skin disease shows up in our littlest patients.
Yeah, that is interesting. Why is there so few pediatric dermatologists?
Well, not only are there too few, but we're kind of geographically maldistributed too. So we're, the academic centers on the coast have a higher proportion. So there's lots of areas of the country that really just don't have access at all. And I think it's a complicated story about why we have so few. And partly, I think it has to do with pediatric medicine in the country in general. We pediatrician or peds-based subspecialties just don't get the recognition or really the value that is placed on adult care. And so across the board, if you look through the American Academy of Pediatrics and different subspecialties in peds, it's very hard to attract great peds people to do more training because ultimately at the end of the day, they make less money because the value is not being placed in pediatric care right now. And I really hope that that can change, and through awareness and advocacy that we might be able to do more, because at the end of the day, what's more important than treating our babies, kids, and adolescents, and with an eye on preventive medicine, so it's really important that people understand that as doctors, we go through all this training, all of our undergrad degree, 4 years of medical school, up to 4 or 5 or more years of residency training, and then asking someone to do more training in a fellowship to ultimately care for the patient population they love and care about and are committed to, but the reimbursement is less. So probably part of the reason.
Yeah. Do you find that you get majority of your referrals from pediatricians?
It's a mix. It's pediatricians in the community as well as other dermatologists who see children with complex skin disease or genetic skin disease, and they realize that they need the expert, the specialist. So it's truly a mix of both, peds primary care and dermatologists that refer.
Yeah. So do you think that there's a larger amount like these skin conditions in the younger population? Are you seeing more and more happening? And that's why there's more of a need for a pediatric dermatologist?
Well, I think the need for pediatric dermatology is very simple. It's just that
Mm,
any skin disease that can affect an adult shows up in children. It may
yeah.
not be as common to show up in childhood as it is in adult years, say with something like psoriasis or
Mm,
autoimmune conditions. But when they do show up in kids, they can look very different from how they appear in adult skin. And so part of pediatric dermatology as a specialty is like really learning how skin disease shows up in children, why it's different, how to treat it, how to make children feel safe and comfortable in their care. And a lot of treatments that we do are in office procedures, things like, biopsies, treating viral infections, laser treatment is something that I do a lot of. So
mm.
we have that special training in how to do these things in children, in our youngest patients.
Wow. So what are you doing a lot of laser for?
So a big part of my practice is vascular anomalies. So children
Mm,
with infantile hemangiomas, port wine birthmarks, all different types of birthmarks for vascular anomalies can be treated in a variety of ways. And for port
mhm.
wine birthmarks and infantile hemangiomas, sometimes we do need laser treatment to reduce the color and make them less apparent.
Mm. Yeah, I've seen that. The port wine birthmarks there. Usually, are they typically pretty large?
They can be. They
Hmm.
have patterned ways that they appear, Janelle. So if
Hmm.
they're on the face, they tend to follow dermatomes of how the child was developing embryologically, a dermatome or a facial segment, and they can be associated with different genetic syndromes. So it's really important that we know not only about how to treat a port wine birthmark, but their associations too, so that we can get those patients the right physicians and refer to the right providers.
Right. So, do you feel like it's really significantly different the way that you are treating your pediatric patients versus, say a mom, she decides, okay, she's seeing a dermatologist and knows that there's something going on with her child that she's like, okay, I need to take them in. This looks like a skin concern. Her taking them to her primary, dermatologist versus a pediatric dermatologist. Do you find more people are thinking, oh, I need to see someone specific in pediatric dermatology?
I think they do. As
Yeah.
we, spread the education and awareness that we are, as pediatric dermatologists, truly the experts in pediatric skin disease, I think there is a need
Mhm.
and, certainly a desire from families to be seen and treated initially right away by an expert.
Mhm.
But as I just told you, we are so small and we have large swaths of the country where there isn't even access to a board certified pediatric dermatologist. So a lot of times, at least initially, a general medical dermatologist will see children and they enjoy seeing children, I think, for the most
Mhm.
part. And when things are fairly straightforward, like a typical eczema patient or typical psoriasis, the way that it shows up, I think that our gen derm colleagues do a fantastic job. But when things start getting a little more complicated, when patients aren't responding to the traditional therapies that they've recommended, or when there are potential genetic syndromes or genetic skin disease or neurocutaneous syndromes that
Mhm.
people are, just less certain about, that's a great time to refer to one of your board certified pediatric dermatologists. And for those listening to the podcast, you can actually find one of us close to you if you go on our
Mhm.
website. Over the past 5 years, we have really worked hard as the Society for Pediatric Dermatology to make a whole host of resources available on our website, and it's at www.pedsderm.net. You can find one of us near
Mhm.
you. You can look at patient handouts and information and even some educational videos on there. So it's a great
Oh, wow.
resource.
That is cool. I was just thinking that too. I was like, okay, how am I going to find a pediatric dermatologist? But yes, that is great. So you are the former president of the Society for Pediatric Dermatology.
I was. It was such an honor. I spent a lot of my career really committed to education. And so working my
Mhm.
way through the Society for Pediatric Dermatology, first as a volunteer committee member, then as the education committee chair for our Education and New Initiatives Committee. And then, I spent 4 years as vice president of education and career development. And then, it was really
Wow.
one of the privileges of my career to serve my society as the president. Yeah, it just ended last summer. So
Oh, wow.
2024. Yeah.
That's exciting. Yeah, that's really so beneficial, I think, for a lot of parents. I work in dermatology anyways, but, when I've seen, family members dealing with issues and things like that, that's just because I'm familiar with it already. I'm like, okay, I think you need to take them to a pediatric dermatologist or, looking for one myself for my daughter. But, I think it's really interesting to know that there really isn't that many. I was not even aware of that. I just thought it was just as common as, all the
Not at
dermatologists I
all.
see were on the
Not at
corner.
all. No, I think that we in Peds Derm kind of have a branding problem, to be honest with
Mm,
you, Janelle, because you are in the derm space and yet weren't aware that there's a shortage of pediatric
mhm,
dermatologists, weren't aware that there aren't many of us. But I'm so thankful that you know that we're out there, because sometimes I even think it's a struggle for our own medical colleagues, even in
mm,
my own town. I think there are certain doctors who even may not know that we exist as a subspecialty. So
mm,
getting the right information into the hands of the right people so that they know who can help them with complicated
mhm,
skin disease in childhood is really important. And so spreading awareness that pediatric dermatology, this is a board certified subspecialty
mhm,
of dermatology. We are really important in the house of medicine because skin disease does not discriminate in terms of ages. It will affect
mhm,
our youngest members, and sometimes with the most severity and the most morbidity. I think about the children who are born in our NICU with disorders of keratinization. That means when their skin has a
mhm,
problem like ichthyosis, where they may be born covered in, a fragile membrane and have plate-like scales on their skin, or they might have epidermolysis bullosa, a chronic and debilitating blistering disease
mm.
caused by, different genetic mutations. It's pediatric dermatologists across the country who step up to take care of these patients, both in the hospital and in the community.
Yeah. As soon as you have a baby, you're taking your baby to the pediatrician, but I feel like that should be kind of a common thing too, is, getting skin checks for your child. Is there a collaboration that you have with a lot of the pediatricians?
Yes. So the Society for Pediatric Dermatology, I would say that we are really very reliant on our pediatrician colleagues, and we have a great relationship with our peds colleagues. For example, there is a very active section on dermatology through the American Academy of Pediatrics. And so
Mm,
we know that our peds colleagues are hungry for derm education and knowledge. And so we help out by going to their conferences, speaking about all the different things, giving lectures, hosting webinars for the AAP.
mm,
So there's a lot of collaboration there, which is really, really good. And I have sat myself on the AAP section on derm many years. I just rolled off of that committee actually this year. And we put a lot of time and effort into kind of reinventing some of the educational materials on the AAP website, healthychildren.org, to make it
mm.
more reader friendly and up to date. So there is a lot of great collaboration between AAP and Society for Pediatric Dermatology.
Yeah. So what about for the patient side? Because I feel like, yes, the collaboration with the pediatricians, but for parents, when they're, bringing their babies in, that is
Mhm.
something that, obviously when you've got a newborn baby and you're wondering, okay, what am I going to put on my baby? What am I putting, what kind of medicines am I using for my baby? Do I need to do this? Is it safe? That's a huge concern. So where is that kind of education that's patient facing?
You're bringing up a huge, really important point. And what you just said is exactly the reason that I started to have an online social media presence in 2020 during the pandemic. So I recognize that there is really a lot of knowledge gap when it comes to care for newborn skin, how we educate medical students about pediatric dermatology and dermatology in general. I think it's no secret that many medical students and residents all across this country feel like they are not getting enough primary derm education.
Mm,
And that trickles down, and it means that sometimes our pediatrician and family medicine colleagues don't feel confident or as confident as they should in caring for basic skin needs for babies and kids.
mhm,
So that is a huge knowledge gap and it needs to be addressed. And I think some people are really looking at this in terms of curriculum for medical students and even for within PEDS residencies. For example, in my position, we have pediatrician fellows and residents following us in clinic shadowing. And that's a
mm,
great way for them to learn on the fly, in that kind of, medical education point of view with residents residents attending clinics, et cetera. But even before that, in medical school, we need better and perhaps even standardized curriculum about this, because I think there are mixed messages and there's a lot of advice that varies quite widely. So in 2020, when the pandemic hit and I saw so many people taking themselves online and doing what I thought was a great job educating in like bite-sized, really digestible format, essentially the social media format. And would you believe it, Janelle? There were no pediatric dermatologists, or maybe one or two, just very few on either Instagram or TikTok at that time. There's a few more now, but I started posting, and you can imagine my surprise that people were interested in exactly the topics that you just mentioned. What should I use on my baby? How can I best take care of my baby's skin? What is safe? What is not? What are the best things available right now? And, you know, when 5 million people watch a video on which baby wash to use, or a topic like impetigo, like the most it's like the most boring thing in the world, impetigo. But when 5 million people are telling you they're hungry for good information, we as a society need to kind of respond to that and think, okay, people are getting their information in different ways than ever before. And as doctors, we need to show up and provide good quality evidence-based information, combat the misinformation that proliferates so widely, and just be present. And that was why I decided to, you know, keep going with it. And I'm still on both platforms, kind of trying to educate in the best way that I can.
Yeah. You know, my daughter is 10 now, but when I was younger, I think a lot of the stuff that I learned was just hearing it from, oh, you know, my mom did this, or, you know, you get all of this additional information from other moms. And now, you know, my sister is pregnant again, and which is funny because I started seeing a couple of different things like on Instagram, and then all of a sudden I start getting all these like baby stuff and information about birthing and all this, which is so funny. So I'm like sending her stuff all the time. And I'm like, she's probably like, oh my gosh, quit sending me all these. But it's so interesting to see, you know, use these baby products, don't use these. These are good for sensitive skin. And, you know, it's wild how much information is out there, but it can be overwhelming too for a new mom and trying to figure out what is the best for their baby.
Completely. And I have to say that, you know, in this experience where I've really taken a very deep dive into baby care, that space, the ingredients, which preservatives, which ingredients can be readily absorbed into baby bloodstream through the skin, it's really changed my perspective a lot on what I do recommend. And it's also made me very aware that we have a lot of improvement to do, because what's on the shelf is loaded with fragrance. And there's absolutely no reason to be spreading fragrance, essential oils, very harsh botanicals all over our infant skin, because we are setting them then up for potential irritant dermatitis, allergic contact dermatitis, which, by the way, once children are sensitized to an allergen, as you know, this is a lifelong condition that they must avoid. And it really bothers me because there are so many ingredients that really just don't need to be in there, and that we are exposing our children to every day. And we need, as a society, as moms, parents, caregivers, as doctors, to really rethink this. You know, when you step back and think about it, should your baby or your toddler actually smell like watermelon or lavender or like whatever? Like, they shouldn't. They're not meant to. Fragrance is one of these ingredients that really isn't highly regulated by the FDA. And when you see the label that just says fragrance in the ingredient list, that could mean hundreds, even thousands of different ingredients that make up that one fragrance. And the individual ingredients are not mandated to be reported, you know, by themselves, because people look to fragrance as a proprietary secret, like it's your special blend and you don't have to tell people what's in it. But I would argue the exact opposite, that it's the responsibility of the manufacturers and the companies to tell us what's in the product, so we can make sure that we feel safe, you know, applying them on baby skin, because there are certain things in fragrance that could be allergens, irritants, and even endocrine disruptors that we know these small molecules are traversing the skin barrier and being absorbed into the bloodstream. So for me, it's
Right.
like I'm kind of passionate about this and educating and spreading awareness because I don't think most people realize that.
Yeah. You want your baby to have the best starting from the beginning, because, if you're potentially using harmful chemicals and fragrance in your products that you're putting on your baby, you're potentially causing them a lifetime of issues, health issues or skin issues.
Thankfully, it's a small number of patients that
Mhm.
develop allergies. But if you look at the literature, there are rising rates of contact dermatitis, allergic contact
Mhm.
dermatitis to components of lavender. Now, I don't think that should
Really?
really surprise anyone, given that
Mhm.
a walk down the baby aisle will just show
Yeah.
you how much lavender fragrance has been touted as like good for baby,
Mhm.
calms baby. But did you know that there's actually no clinical evidence to that effect?
Wow.
So we're doing this. Every product has lavender without
Yeah.
any onus on the companies to prove that that lavender fragrance actually has some kind of benefit to the
Yeah.
baby, because it really doesn't.
That is wild. I know. And that's like a huge trend. Everything is lavender right now. I mean,
Totally.
lavender coffee.
Yes, you can drink a lavender latte. You can
Right.
put
You can
lavender
smell
all
like
over your
lavender.
skin.
Right.
And you know what, Janelle? I'm not a fragrance hater. Like I mean, think about your life and
Mhm.
the wonderful set. Like it's one of our main senses, and it's just it can elevate an experience, and it's just wonderful. But applying fragrance to the skin is
Mhm.
very different than smelling it.
Right.
And so I think we have to start realizing that we might be doing more harm than good.
Yeah. Absolutely. Wow. That's so good. Okay. So you co founded a skincare brand for boys. This is something new, because most of this, you always think of skincare and it's always just girls and it's all cute and everything. But there's not really much out there that you think about for just for boys. So tell me a little bit about Strike Club.
I would love to. Thank you for asking. So I'm a mom of two tween, well, now one teen and one tween boy. And as a pediatric dermatologist, it's pretty obvious when you walk down the aisle at Target or Walmart or any of these big retailers that boys have been really left out of
Mhm.
skincare, right? We are living right now in the world of the Sephora kid trend where girls are being targeted with all of this like excessive marketing, and they're using tons of products, multi-step regimens that may not even be necessary or good for their skin. So we
Mhm.
have that going on while simultaneously boys have nothing. They've been completely left out. You just need to walk down the aisle and see the pink colors, the fruity scents, all of the
Mhm.
things that are out there right now are mainly targeted for young girls. So, making a product safe, clean, effective, that fits into a boy's lifestyle in a different way. These boys typically, in my clinical experience, are not going to be the ones doing a 10-step skincare routine. Now, some might. Some may really think that that's like a fun thing to do and recognize that self-care is important, but a lot don't. And
Mhm.
I think it really has kind of hit a nerve, because as soon as we launched Strike Club in 2021, there were actually a couple other brands dedicated to boys that kind of came up after us. And so I think people are seeing this white space here in the market, and that boys really had no choices before. They would
Mhm.
either have to borrow from their sister and use something pink and embarrassing to them, or they would have to be forced, especially if they were dealing with acne concerns or changing skin, like happens, right around that time and, in a tween's life, things that were there since the 1980s and 90s that even I
Mhm.
used as a teenager, like Clearasil and Noxzema. I mean, it was really time for reinvention of what does good skincare, what does early adoption of healthy hygiene mean for boys? And
Mhm.
I personally think we nailed it. And I'm so proud of the company. It's Strike Club with a Y, Stryke Club. And we are on Amazon and a direct to consumer site. So check us out, because we have a patented formula that is super effective for cleaning skin and addresses the needs that teens get, like infection or
Mm.
razor bumps, folliculitis, acne. Our cleansers, our moisturizer, and our wipes have sodium hypochlorite in it, which is
Mm.
kind of a variation on hypochlorous acid, which is all over now too with sprays of hypochlorous acid, which I love, and essentially is kind of like doing a diluted bleach bath in a way.
Mm.
So really helps with infection, inflammation, and just overall a great way for teens to engage in early habits in a safe and fun and unfussy kind of way.
Right. So so you said there's not many steps. So for a boy that's not really trying to pay attention to what, go wash your face. Okay. I mean, I'm still struggling with my daughter a little bit, trying to get her in a regular routine. So how is this easier for boys that are not really interested in having a routine?
Janelle, if you throw our wipes into your son's backpack, they literally don't even need a sink. That's what I'm talking about, on the go. Like, they've got the
Yeah.
wipe, it will gently clean them. It's fragrance free, hypoallergenic. They can use it to wash their face, then clean off equipment. It's antimicrobial. And then in the shower, our everywhere wash is like, which is like a lot. It's a good size bottle. You can use that head to toe all the
Mm.
way. So it's really one step there. And
Oh,
then
wow.
we do have a face wash, which is fragrance free, and a moisturizer fragrance free for those with more kind of dry, sensitive skin. We also launched some pimple patches, which I love because I just think that those hydrocolloid pimple patch dressings are just a great way to speed healing with an outbreak and keep hands off. So they're really, I think, a great addition to boys' skincare when they have
Yeah.
acne. Yeah.
That's cool. So, okay, just a question. You probably already know. So, I know there's already so many girls products, but would you consider having any girls lines, or do girls even purchase some of these products at all?
I think, yes, I think you're absolutely right. I think even though our marketing is really kind of with an eye towards boy,
Mhm.
it truly is safe for all tweens and teen skin,
Yeah.
right? So a teen type of messaging, those girls who I think are more into sports or athletes,
Mhm.
or that really just don't love all of the ultra feminine, like fruity packaging. I mean,
Right.
there are a lot of girls that do use Strike Club, and even
Mhm.
though the market whole, I think, was really boy, our products can be used by everyone. For example, I use them every day because I think it's good for my rosacea.
Yeah.
I think you've made a really good point, and certainly we don't want to discriminate or not have girls use the products. I think those girls that kind of prefer less fuss, those girls
Mhm.
that are not wanting to do the 10-step regimen, those girls that maybe more lean towards more athletic, I think we've seen a lot of them using our products. So
Yeah.
it's for teens, but yeah.
Okay. So what exactly would the age ranges be? And then, like, well, you said you're using some of the products as
Anyone can
well.
use it, honestly, but I did formulate it with very few ingredients, like with an
Mhm.
eye on minimizing allergen exposure,
Mhm.
making sure that we had the antimicrobial and anti-inflammatory components there, using
Mhm.
only safe preservatives, gentle surfactants. So it's really it's
Yeah.
extremely gentle. And even the National Allergic Contact Dermatitis Society actually has our products as safe on
Oh,
their
wow.
on their camp websites and things. So we're really proud of. So anyone can use it. Those with sensitive skin, prone to eczema, those prone to acne, for sure, rosacea. So I don't think there really is any age limit. But in
Mhm.
terms of when we're starting to get our tweens and teens into thinking about skincare, I think
Mhm.
around 9 or 10. That's a good time to say, you know
Yeah.
what? Maybe you should wash your face when you brush your teeth at night. That would be a great first step. Remove the dirt and debris from the day.
Right. Yeah. No, that is so good. I think just getting the kids into the routine in that age, but also knowing that the products are good for anyone, it says a lot. We want good, clean products for our skin, especially at that young age where they are going through some hormonal changes and, dealing with some acne and, unwanted.
Yeah, we're really proud of the products and the way they really are pretty streamlined. And our moisturizer actually is the only moisturizer currently on the market that has sodium hypochlorite in it. So it's the only moisturizer that actually fights acne while it's moisturizing your skin. So
Wow.
we've won awards for that one. And then our washes and formulas are patented too. So
Oh,
we're
wow.
getting there. We're, I think, gaining
Yeah,
momentum. So
that's
exciting.
exciting.
Yeah.
That is so exciting. Okay. Well, we will definitely make sure we have the link to the website in the show notes, but it's also found on Amazon as well. So that
Thank
is
you.
really cool. And now I kind
Yeah.
of want to try. I'm
I would
going to
love
try
for
that
you to try
lotion.
it and give me feedback.
That's exciting. So
Mhm.
tell me, what is next for you in general, for Strike Club? You know, tell me what's on the horizon.
I mean, we're so proud of Strike Club. We're moving forward. We have just actually hired someone else to help kind of tweak our marketing messages too. So that's really exciting. I mean, I just love the opportunity to educate, to offer something new and clean and derm formulated. That's like a real passion. We might be heading into a new market, and it's too early to say yet, but I think you might be able to guess. So,
Okay.
but I will keep you posted if and when we're launching. We're still doing some market research and looking into a specific new area. There are lots of exciting things on the
Yeah,
horizon for sure.
that is exciting. Well, I was going to ask you earlier, what are your top products for newborns or little babies?
I
Do you
love
have
that
any?
question. So I want moms and caregivers to become good label readers. And
Mm,
sometimes, Janelle, it's more important what is not in the product than what is.
okay.
So I always start by saying the best we can do in the current unregulated environment, because as you know, the health, wellness, and beauty industry is not regulated by the FDA to the same extent at all
Mm,
as the pharmaceutical industry. So we're really kind of left on our own. We have to develop our own tools.
hmm
And I think right now, today, the best we can do is look for products for our newborns that are fragrance and essential oil free, that are hypoallergenic, and that are dermatologist tested. Now, none of those terms are regulated at all by the FDA, but I do think that companies that are larger with good integrity have probably done the additional testing to warrant those claims on the label. I really
hmm
do.
Yeah.
So, who do I think is doing a good job? I think Vanacream does a very nice job. So, if we're allowed to say brands on your podcast, I think
Yeah, absolutely.
Vanacream is doing a nice job. The Vanacream baby wash is great. There,
Mm,
another company that I think is doing a nice job with washes are the fragrance-free versions of the Pipette baby line. I think they're doing a great
okay.
job. Mistela is also fabulous. They do have quite a few of their products that do have fragrance, but the fragrance-free cleanser, the Stellatopia line, the micellar water, all are really, really, I think, very good.
hmm
And then as a peds derm and a mom, and having had, babies myself, I am going to tell your listeners that you just can't do better with an occlusive moisturizer than plain Vaseline petroleum jelly.
Mm,
The blue
okay.
one, not the pink one. The pink one has synthetic fragrance and it's not recommended, even though it's marketed for baby. It's not the right one. You want to be using the navy blue top plain Vaseline.
Mm,
And there's so much misinformation about petroleum jelly online these days. People are citing old data, cherry picking the wrong
yeah.
information that talks about contamination in petroleum jelly. But in today's world, USP grade white plain petroleum jelly is like literally the safest thing you can apply on your baby because it doesn't need a preservative. So there's no preservatives that could potentially be absorbed through the skin. It's a very thick hydrophobic. It's a big molecule. So it kind of sits right on top, right?
Mm,
And prevents the water from evaporating. And that is what you want. You want to
okay.
prevent transepidermal water loss in babies because their skin is a little thinner and the
Mhm.
lipids are not quite mature. They're not the same as an adult skin. So they're losing more water than we are. So I really love for moms and caregivers to know about the soak and smear method. One of the best ways that you can treat babies that have rashes, cradle cap, baby acne, anything like that, a soaking bath,
Mm,
minimize the soap, and then Vaseline head to toe. Soak and smear.
wow.
It's always going to get you out of trouble.
Okay. I wish I had known that when I my had cradle cap, and that was hard. That was a rough thing. Yeah.
A lot of people are forgetting to soak their baby. There's a lot of different bathing appliances. Have you noticed? Like ones that are just slings or ones that baby sits up in.
Yeah.
But really, the act of soaking is so important because
Yeah.
when you soak the skin, the water gets into the stratum corneum and has a natural exfoliation. So the top layer then kind of desquamates off. And that's where the dirt and debris is. So you can think of if the baby's head is never getting soaked and the skin is like, continuing to build up, and then we have yeast involved and, on the dead skin buildup. So we've got some seborrheic dermatitis happening. Soaking is a really great idea. So don't forget the scalp. Don't neglect the scalp with your baby. When you're washing your baby, soak all the way. And if the head can't kind of get soaked, put a nice, really damp washcloth on and get all of that saturated, because that will really help remove all that debris.
Does that help prevent cradle cap?
I think it does. Yep.
Interesting. That's good to know. That's wild. I had no idea.
Yep. I think it's really interesting because there are certain lipids that are expressed on the skin in infancy. Some of the last places that they come out, these natural moisturizing factors, are the cheeks, which is why babies oftentimes will get really dry, chapped cheeks because they're not able to hold in the water. So that idea of soaking, smearing, preventing irritants, that's all important.
That's so good. I love it. Well, thank you so much for joining me. This was so enlightening. And now I'm like, oh, okay, who's got a baby that I can go? My sister's going to have one soon. I just found out she's having a boy. So I'm excited to.
Congratulations.
It's so exciting. But now I'm like, all right, what can I share with her? What products can I get? Make sure she's
got a lot of tips. Well, if you look at my TikTok, I give a lot of free advice on there. So you could go.
We'll be looking that up for sure.
Yeah.
Oh, well, thank you so much for joining me. And this was so much fun. Look forward to connecting again soon and checking out Strike Club for sure.
Thanks, Janelle. It's great to be here.
Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.